Hi everyone. Today in this video let us discuss Bupropion versus Buspirone. The two drugs Bupropion and Buspirone are somewhat confusing. They are starting with similar letters and both are ketone derivatives which can be observed in their suffix. And interestingly, both of these drugs acting on the CNS to treat few of the mental conditions. But these two drugs are not equivalent and they are classified into different categories. Bupropion is well known with the brand name Wellbutrin, whereas Buspirone is well known with the brand name Buspar. Even both of these drugs are somewhat different. They can show few of the similarities. So today in this video we are going to compare Bupropion with Buspirone. We will see what are the similarities and differences between these two drugs. First of all, let us see the clinical use of these two drugs. What is the indication of Bupropion? Bupropion is classified as atypical antidepressant. Here the term atypical indicates that this drug is a new generation antidepressant that works by unique mechanism with somewhat less side effects compared with old generation antidepressants. And this drug is particularly indicated for the treatment of major depressive disorder commonly known as MDD, which is a one type of mental illness associated with depressive symptoms. In such conditions, Bupropion can be used as atypical antidepressant. On the other hand, Buspirone is not an antidepressant. It is classified as anxiolytic. So it can be used to treat the anxiety and it is particularly indicated for the treatment of generalized anxiety disorder, GAD. This is one of the anxiety condition without any proper reason which can be observed for long periods. In such conditions, Buspirone can be given to control the anxiety. So both of these drugs are having the different clinical indications, and particularly Bupropion can be given when the people are having depressive symptoms such as low mood, no initiation, lack of interest, feeling of guilt, pessimism, negative thinking. If all these symptoms are observed, then Bupropion can be given as an atypical antidepressant to elevate the mood and relieve the symptoms. On the other hand, Buspirone can be given to the people who are having anxiety symptoms like feeling angry, irritability, and a feeling of worry, which further increase the anxiety. If these symptoms are observed in the people, then Buspirone can be given as anxiolytic. So now we can see the clear difference between the Bupropion and Buspirone. Bupropion can be given to control those symptoms which are associated with central depression. It can particularly control the negative thinking and negative thoughts, whereas Buspirone is particularly used to calm the patient, agitation and irritability, and improve the lifestyle of the people. So this is the first difference between the Bupropion and Buspirone. Both are used in different clinical conditions. Apart from these clinical uses, Bupropion can also be used for other conditions. It can also be used for smoking cessation. Similarly, Bupropion can be combined with another drug naltrexone. It can be used to control the overweight, so it is used as a weight loss medication along with naltrexone. So these are the other clinical indications of Bupropion, whereas Buspirone is not having any other indication, but this drug is tested for the treatment of unipolar depression. This is a condition where we can always observe depressive symptoms in the people and they are not shifted to the manic phase. That's why it's called unipolar depression. So Buspirone is tested for treatment in the unipolar depression. Still efficacy is not clear and it is not approved by FDA. That's why right now Buspirone is not used as antidepressant. It is only indicated for the treatment of anxiety. Second comparison, when they are avoided. What are the contraindications of these two drugs? Bupropion is particularly contraindicated in the people having history of seizures. Since Bupropion can induce the seizures, in the people with any history of seizure induction, Bupropion should be avoided. Similarly, those drugs which increase the risk of seizure induction, they should be avoided with Bupropion. Similarly, another contraindication is the anorexia nervosa. This is a condition where the people are having excessive eating habits, which can increase the risk of seizure induction in the people. So in these conditions, Bupropion is contraindicated. On the other hand, Buspirone is not having any significant contraindications, but it should be avoided in those people who are having hypersensitivity and allergy with the use of Buspirone. Third one, time to show their effect. At this point, both bupropion and buspirone show similar effects. Both of these drugs are acting centrally, but they can show some delayed pharmacological actions. That means they cannot produce the therapeutic effect immediately after administration. They take few days of treatment in order to show their therapeutic effect. For instance, bupropion cannot reduce the depressive symptoms immediately after the administration, but it can take around 2 to 4 weeks in order to elevate the mood and reduce the symptoms of depression. Sometimes it can also take more time, around 4 to 8 weeks, to produce beneficial effects. Similarly, buspirone can also take 2 to 4 weeks time in order to show its anxiolytic effect. So at this point, both of these drugs are having similarities. They produce delayed pharmacological actions. Fourth one, how they work. At this point, bupropion and buspirone somewhat differ. Bupropion can affect the two types of neurotransmitters. One is the norepinephrine and second one is the dopamine. This drug can bind to the norepinephrine transporter, thereby it can increase the release of norepinephrine. So this drug increases the norepinephrine transmission within the CNS. Similarly, it can block the another transporter DAT, dopamine transporter, thereby it can increase the release of dopamine, which can increase the dopamine levels within the CNS. In this way, bupropion mainly acts by increasing norepinephrine and dopamine levels within the CNS. On the other hand, buspirone affects the serotonin transmission. This drug can block the 5-HT1A receptors, which are autoinhibitory receptors. By blocking these receptors, initially buspirone can reduce the release of 5-HT, so serotonin release is initially inhibited. But after a few days of the treatment, the 5-HT1A receptors are desensitized because of their repeated activation with buspirone. So this results in decreased activity of 5-HT1A receptors, thereby 5-HT release is increased. In this way, buspirone initially reduces the 5-HT release, but later it can increase the serotonin release. This requires some time, that's why buspirone shows delayed pharmacological actions. Again, at this point, bupropion and buspirone differ, that's why they are used for different clinical indications. Fifth one, dosage. Bupropion is available as a tablet, which is of two types: immediate release tablet, where the drug is immediately released within the stomach, and second one is the extended release tablet. This is a formulation from which the drug is slowly released in an extended way. So these two formulations are available for bupropion, and this drug is initially started at 150 mg given once daily. The dose can be increased to a maximum dose of 400 mg or 300 mg based on the clinical indication and the patient conditions. But the starting dose of bupropion is 150 mg given once daily. On the other hand, buspirone is available as an immediate release tablet, and it is given at a dose of 7.5 mg given twice daily. So the total daily dose is 15 mg. This 15 mg dose can also be given in another way as 5 mg tablets thrice daily. So we can clearly observe that buspirone is given at very low dose compared with bupropion. Sixth one is the side effects. Both of these drugs, bupropion and buspirone, act on the CNS, so they can produce some central side effects which are somewhat similar. Since they act on the CNS, they can produce some dizziness, lightheadedness, insomnia, lack of sleep can be observed with these two drugs. Similarly, they can produce other central side effects like headache and drowsiness, but they can also show few of the specific side effects. Bupropion can increase anxiety in the people, whereas buspirone can increase the restlessness in the people. These are the specific side effects produced by bupropion as well as buspirone respectively. So few of the side effects are similar, but few of the side effects are specific to these two drugs. Seventh one is the effect of MAO inhibitors. At this point, again, bupropion and buspirone show similarity. MAO is one of the cleavage enzyme monoamine oxidase. This monoamine oxidase can produce the metabolism of catecholamines like norepinephrine, dopamine as well as 5-HT. So when MAO inhibitors are used along with these two drugs, they can show few of the drug interactions. So drugs like phenelgyne, tranylcypromine, isocarboxide, even antibiotics like linezolid, all these drugs are having MAO inhibitory activity. When they are combined with bupropion and buspirone, they can produce serotonin syndrome, resulting in few of the symptoms like agitation, confusion, insomnia, and hypertension. All these are collectively called as serotonin syndrome. So these two drugs should be avoided with MAO inhibitors. and there should be at least 14 days gap between the administration of these drugs and MAO inhibitors. Eighth one is the effect of alcohol. Since both bupropion and buspirone act centrally, they can also affect the activity of alcohol. Alcohol is a CNS depressant, so when it is combined with bupropion, it can increase the seizure induction. Similarly, when it is combined with buspirone, it can increase the drowsiness. Because of these effects of alcohol, it is recommended that alcohol should not be taken along with bupropion and buspirone. Ninth one, other interactions. Interestingly, both bupropion and buspirone are metabolized by CYP3A4 enzyme, one of the metabolic enzyme within the liver. So CYP3A4 inhibitors like ketoconazole, fluconazole, clarithromycin, diltiazem, all these drugs can affect the metabolism of these drugs. Thereby, CYP3A4 inhibitor should be carefully combined with either bupropion or buspirone. So at this point again, both of these drugs are somewhat similar. 10th one, effect on liver. Here we can find another difference between bupropion and buspirone. Bupropion can increase the risk of hepatic damage, so it can produce some hepatic impairment, whereas buspirone is not showing such activity. Instead, it can improve the hepatic function. So hepatic impairment is more pronounced with use of bupropion. In this way, bupropion and buspirone are the two drugs which are looking somewhat similar, but they are somewhat different. Bupropion is an antidepressant, whereas buspirone is an anxiolytic. Even both of these drugs are having few of the similarities, but they are indicated for different purpose and they are not at all equivalent. So that's about the comparison between bupropion versus buspirone. Hope this video is useful to you. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.